Okay. There have been many people asking questions. Can I go through the frequently asked questions first?
Sige, Doc. What's the FAQ about this Linyan? Tama ba, Lianhua? Nahirapan ako Lianhua Qingwen.
Lianhua Qingwen. It is a classic herbal tradition. So it's an old medicine. It's an old formula of herbal medicine. It is made out of several herbs. The key ingredients are the Lianhua and the Qingwen, okay, which are forsythia and honeysuckle. Okay. This formula is used to treat. It's a symptomatic treatment for the symptoms of flu and infections. Okay, kasama na dyan yung certain conditions of SARS. Okay. One of the frequently asked questions is this an antibiotic? Is it an antiviral? Will it combat the virus? The answer is no. Okay, so it's not an antibiotic, it's not an antiviral. Is it a prophylaxis? Is it preventive? Will it prevent me from getting infected? The answer is no. Okay. Is it a supplement? Is it something that I can take like vitamins to improve my health para hindi ako mahawa? The answer is also no.
So hindi siya pwedeng prophylaxis, ha?
Hindi siya pwedeng prophylaxis. Kung wala kayong sakit, huwag nyo i-take ito. Kasi it's not
parang vitamins, no, Doc? Kasi some are taking it bago pa man sila ma-expose or magka-COVID sa tingin nila, no?
Mali yun. Hindi yun makakabuti. And it might even be harmful for people with certain medical conditions, other pre-existing conditions.
Kasi Doc, alam niyo po yung iniisip ng mga tao na porket po ito ay herbal supplement, ay iniisip nila safe, no? Alam mo yun, parang tsaa lang, no? Parang gano'n na umiinom sila ng tsaa. Sinasabi mo na kahit ito ay herbal medicine, ay meron tayong pangamba. Kaya ito ay piniprescribe ng doktor, no? Doc, ayun po ang instruction ng FDA. Bakit po?
Yes. Not all herbals are safe and not all herbals are meant to be supplements. This herbal medicine is very potent. It's very strong with very strong effects, and it is meant to treat specific conditions. Yun nga, the symptoms that you have under COVID.
Doc, ano yung mga specific symptoms that we have to watch out for na maaaring tugunan ng herbal medicine na ito?
If you get sick, if you have contract COVID, and then your pattern is a lot of heat, a lot of fever, a lot of inflammation, okay, discharge in the nose, clogging up the nose, congestion in the nose and throat, okay, then this is going to help you. What the Lianhua Qingwen will do is it will clear up the congestion. It will stimulate your body actually. And it will break your fever. Yung magpapawis kayo, you know that feeling na when the immune system kicks in and then yung magbe-break yung fever, just magpapawis. So this is what it does. It forces that breaking of fever, decongesting of the lung system. Okay.
So that's what happened to sa FB po, according to the FB post of Benher Abalos na nangyari, he took it while waiting for his swab results. Kasi probably he felt some symptoms like diarrhea raw, Doc, and other mild symptoms. So he took it, so he broke into a sweat na sobra raw. Pagkatapos, after daw nun, I felt fresh, lightheaded, and no more symptoms of any kind whatsoever. Yun ang kanyang personal experience with this drug.
But I'd like to point out that maswerte si Benher Abalos that his symptoms are indicated for Lianhua Qingwen. Because if you have different symptoms, like if you have a lot of chills, if you're feeling cold, okay, this might actually make it worse.
Okay. Doc, alam mo
what do you mean? Sorry ha. Ano yung if you're feeling cold? Kasi meron kayong sinasabing warm and cold symptoms.
Correct.
Medyo confusing. Ano po yung warm and cold?
The warm and cold. Mag-lecture na ako ng traditional Chinese medicine. But the basic is, even if we get infected by the same COVID virus, our bodies react differently. Our bodies, yung iba may pre-existing conditions, yung iba ang response ng body iba. So, if your body is hot, dry, inflamed, and then a lot of congestion, okay lang yung Lianhua Qingwen. If you don't react like that, na nanghihina ka lalo, is linalamig, is nag-chills, or you're already sweating a lot, spontaneous sweating, okay? Lianhua Qingwen will make it worse. It's the opposite. So this is not the herbal for that.
So Doc, pwedeng ulitin ko lang, gusto ko lang i-emphasize yun. No? So ang sinasabi mo, ito yung tinatawag kasi nababasa ko ang daming posts, madami tayong mga Chinese na doctors na nagsasabi nga at nag-warn na kapag ang simptomas mo ay on the cold type of flu. Ibig sabihin yung Doc, ulitin ko na kapag ikaw ay nag-chills, kapag ikaw ay, tama ba yung chills, ano pa yan, Doc, nagsusweat ng madami.
Even cold, yes. Spontaneous sweating, pinapawisan ng madami na.
At saka na isa, you're feeling cold, malamig. Ito po ay hindi...
Parang giniginaw.
Giniginaw. Ito po ay hindi para sa inyo.
Yes.
Tama? Okay. So, para to sa may mainit lang, tama? Because parang ang pagkakaintindi ko ay tinatanggal niya yung init sa katawan, tama, Doc?
That is a simple way of explaining it. But yes, that's accurate also. I'd also like to point out, there is one ingredient in Lianhua Qingwen, the formulation, is ephedra. And ephedra is a known stimulant. If you read the literature on Lianhua Qingwen, it says, please be careful, use this if you have hypertension. When you're using this and you have hypertension and heart disease, you have to use this drug carefully. Because one of the ingredients is ephedra, and that might stimulate, that will overstimulate your heart, and baka mag-hypertensive crisis ka.
Okay, so hindi siya...
Yes.
Hindi siya pwede sa mga may heart problem, Doc? What specific heart problem na hindi siya pwede?
Hypertension, heart disease, or any past, like if you've had a previous heart attack, okay? Hindi naman sa hindi siya totally pwede, but because there is this added risk, you have to have your doctor monitoring you if you are taking this drug.
Okay. So, Doc, are you saying na, kunyari, syempre, sino naman walang hypertension?
Parang lahat may hypertension.
Ako, Doc, sa edad ko, meron na rin ako.
Oo.
So, parang... Magkaedad lang tayo.
Kaya nga, Kit. So, you're saying na, siguro, you're saying na merong ephedra ito na maaring mag-cause ng palpitations, maaring mag-cause ng pagtaas ng blood pressure. Pag ininom mo to, medyo guided, medyo dapat minomonitor mo yung iyong blood pressure, no?
Yes.
Tama ba yun?
Yes.
Para pag ito, kung nakukuha mo yung side effect at tumataas, ay medyo either bawasan yung dose or talk to a doctor para alam kung anong dapat gawin. Tama, Kit?
Well, ideally, because this is FDA approved, the doctor is the one who should prescribe it first. Na say na, sige, we'll take this drug and I know that it will be good for your condition of COVID. I know you have hypertension, but I'm monitoring you.
Okay.
If you read the literature, it also says, on the pamphlets on the drugs, it also says you have to take it only for a short time. 4 capsules 3 times a day, but only for a short time, limited time. It's not a 2 weeks long-term usage of this drug also.
Kit, dun sa nabasa kong literature, no? I think it's the only randomized controlled trial study nitong herbal medicine na ito. Ibig sabihin nun, partner, ito yung parang magandang trial na ginawa, no, for this. Tama, no? Clinical trial na ginawa for this to see kung effective. Partner, nakita naman na effective yung gamot, di ba, Kit? Kaso meron sinasabi na parang side effect of a possibility na pwedeng mamaga ang atay. Doc, anong masasabi natin dito?
That is also another risk factor because it uses the liver and the kidneys to metabolize this drug. So also, if you have liver disease or kidney disease, you have to watch out how to use this drug. Maybe the drug will be lowered, or you shouldn't take it for so long, as short as possible, yung dosaging.
Okay, Doc, ano pa yung ibang contraindication? May nabasa ko, may taong may asthma, for example. Anong effect niya? Should a person with asthma take this medicine? Kasi minsan ano rin yun yung sintomas ng asthma is the same symptom as COVID?
First of all, well, there's this allergies in general because it is plant-based. So people have plant-based allergies or have strong allergies to other plants might be careful about taking this medication. You should also avoid, if you're taking this medication, you avoid cigarettes, alcohol, and spicy foods and greasy foods.
Doc, how about taking it with Western medicine, yung mga ibang drugs? Pwede bang isabay to as you take? Kunyari, inom ako niyan, iinom din ako ng paracetamol, ay mga ganyan. Pwede bang isabay?
That's a tricky question. That's a difficult question to answer. Yes, because you have to have expertise in both Chinese medicine and Western medicine.
Okay.
And you have to be careful of the drug interactions of these. In general, you can take this if the symptoms are mild to moderate. You can take this, and you're also taking other drugs. Okay, but if you have more severe symptoms such as high fever, or you have underlying conditions na mentioned, okay, ang pinaka nakakatakot dyan, Luisa, is the heart because of the ephedra that is in this formulation. Yung mga heart conditions and hypertension. Yun lang ang babantayan natin.
So, Doc, yung mga bumili ngayon nitong gamot na to, ang dami yung bumili. Iba 10 boxes, 20 boxes na parang vitamin, kailangan talaga na may supervision ng doctor. Sabihin sa doktor at mabantayan siya.
I want to reiterate that this is a drug for symptomatic treatment of having COVID. So, there's this condition that you must be sick muna. You must have been infected first. And as much as marami nang nai-infect, a lot of people are also not infected. If you're not infected, don't take this muna. This is not preventive. This will not.
Pero Doc, you're saying na ito kaya, kasi like ang dami nagsasabi, bakit kaya ang bilis-bilis in-approve ng FDA to? Kaya pala matagal na itong gamot na to na ginagamit. Hindi lang for COVID, ginagamit nga for patients with the symptoms of pneumonia, trangkaso. Ibig sabihin, hindi ito for COVID symptoms only. So ang ginagamot niya, hindi yung sakit, kung hindi yung symptoms, no? Yung nilalagnat. So possible ba, kunyari ako, feeling ko tatrangkasuhin ako at ako'y nilalagnat, masama ang katawan ko, mainit ako, may sore throat ako, inuubo ako, can I take this herbal medicine?
There are milder and safer medicines to take. Like paracetamol, more known and less risk factors. So if you think na hindi naman COVID yan, let's stick with what is safer, what is more understood, and what is more known. Okay?
So you're saying, Doc, this is a strong, potent medicine na hindi basta-basta, para siyang antibiotic, kumbaga, na kailangan talagang may doctor supervision.
It is a strong medicine that is also for the symptomatic treatment. Meaning, the symptoms that you get because you have the virus, because you're infected. Okay? So it's not going to treat the virus also. It's not going to get rid of the virus. It will help your body get through the symptoms of fever and the dryness and then the congestion and the soreness throughout your body. It will get you through those flu-like symptoms.
So, Doc, you're saying,
symptoms.
So you're saying for those who are non-COVID, but have the symptoms of a flu, kasi nga, ngayon ay umuulan-ulan, nag-change of temperature tayo, madami ring sinisipon, inuubo, nilalagnat, you prefer na yung ordinary meds like paracetamol ang inumin pa rin at wag ito?
Treat it as a flu and get yourself tested. When you're sure that you have COVID, then we can ask for Lianhua Qingwen.
Okay, and also it depends on the symptom. Doc, would you recommend na mild, moderate, severe? I mean, dun sa mild, moderate, it works. When does it work best?
Mild and moderate, it will work best. In severe cases, it might still work, but usually in severe cases, you'll probably be in the hospital already, and there will be other medical treatments that can and should be done to you.
Now, let's say, Doc, na yung tao matigas ang ulo, nag-take At yung kanyang sintomas ng flu ay yung sa cold type, hindi yung warm type. Yung bawal ang di ba? Bawal yung Lianhua, Lianhua Qingwen, bawal. Anong pwedeng mangyari sa taong ito? Can he die? Or anong side effect ang pwedeng mangyari?
Yes, pwedeng puro side effect ang tatama sa'yo. So kung linalamig ka, malamigin ka, you take this, lalamig ka lalo. Manghihina ka at lalamig ka. Okay? If you're already sweating a lot with your flu, the cold type of flu, and then you take this, mas lalong magsusweat, madi-dehydrate ka, manghihina ka. So yes, this is the wrong medicine for that condition. So you will just get all the bad effects.
Okay. So, Doc, do you suggest generally with everything that you're saying, I guess dapat magpa-doktor ka muna tapos, di ba? Dapat para talagang ma-assess yung iyong kondisyon at tama yung diagnosis, di ba?
I think, Luisa, we have to focus more on, if you are not yet sick, you have to focus really on the preventive and what is known to support your health. There's social distancing, there is hygiene, there is good sleep, there is a good diet, okay? Even mental health. Yun pa rin ang pinupush natin. That is known. Walang side effect yun. Only if we start feeling sick, then we start talking about medication.
Tama